Hi, I'm Charlotte Moser, filling in for Dr. Offit to share this month's episode of Vaccines and Infectious Diseases in the News. I'm speaking to you today from the Vaccine Education Center at Children's Hospital of Philadelphia. And we thought this month we would talk about 3 things people should take away from the recent Ebola and Hantavirus headlines. Now, if you've been watching any news or if you've checked socials in the last few weeks, you've likely heard about these 2 situations. So we're not going to rehash the details of each here. However, we do think that looking at how these 2 incidents have been handled is important for understanding just how precarious the current public health situation is. We realize that mistakes were made during COVID-19, and we also realize that much of the current situation when it comes to public health is a direct result of how people felt about the pandemic and how it was handled. Unfortunately, what may seem like well-deserved payback for actual or perceived injustices is actually making all of us less safe. If another novel coronavirus or an influenza virus capable of causing a pandemic presented itself today, we would be in an even worse situation than we were back in the spring of 2020. The recent responses to the Ebola and Hantavirus headlines provide evidence that can help us understand why. First, the career scientists who had irreplaceable depths of knowledge and experience related to specific areas of pathogenesis and epidemiology are either gone from the government or have been sidelined. Normally, that is to say historically, in these situations, there would have been an institutional knowledge as well as a leadership that relied on those who held that knowledge. What we've heard are reports that demonstrate an unprepared and uninformed response. For example, state officials were finding out about individuals from the cruise ship returning to their states from news reports instead of from federal officials. We recently learned that HHS leadership is asking for CDC volunteers to monitor passengers coming through airports from places with Ebola, rather than having trained and knowledgeable staff at the ready for deployment. We've also heard reports of only a limited number of CDC employees being allowed to participate in WHO calls about the Ebola situation, and they're only being allowed to listen but not offer any guidance without getting prior approval from the U.S. chain of command. These stories by themselves may seem minor, but they offer accruing evidence of a federal leadership that doesn't know how to handle a public health emergency and either isn't knowledgeable enough to appropriately gauge the level of concern or humble enough to learn from their career staff who have that knowledge. Second, we ask that you pay attention to how United States citizens are being treated if they're potentially exposed or if they become ill, and to think about what you would want to happen if you were in that situation. The United States has among the best medical facilities in the world. If you were on a cruise ship or volunteering in a developing country and were potentially exposed to or infected with a deadly virus, where would you want to get your medical care? I suspect, like me, you would want to return to the United States for your care if at all possible. Indeed, we have facilities in this country where the staff have trained for just such a possibility, and the facilities have been equipped for containment. We saw many reports about the facility in Nebraska as the cruise ship passengers exposed to hantavirus returned to the United States. But what we've heard in subsequent days is that some passengers who don't have symptoms or positive tests are being forced to stay in the facility, ironically with stay orders signed by officials who themselves decried COVID-19 lockdowns. And those exposed to Ebola are not even being allowed back into the United States. Officials are seeking to establish facilities in Kenya to treat any infected United States citizens. Even if those facilities are staffed by U.S. healthcare personnel, the care is unlikely ever to reach the level it would if the patient was being cared for in the United States. Not to mention that this approach also requires other U.S. citizens to be willing to go to Kenya and be exposed to the virus, knowing that if they become ill, they also won't be allowed to come home for care. It's one thing to say you're protecting the citizens of the United States from bringing an infectious disease like Ebola into the country, but it's amoral to do so when you have the facilities and expertise ready to go, and it's another U.S. citizen who's being denied their rights simply because they happened upon a pathogen during their travels. This is leadership by fear, not strength. The United States has Ebola experts, and those leading the federal charge could be informed by what those experts know, so as to protect the American public while also not leaving fellow citizens behind. And that brings me to the third takeaway from recent events. When it comes to infectious diseases, global health is local health. Our enemy is the pathogens that do not recognize borders. The extent to which we're divided in the fight against them is the extent to which we are collectively weaker. There is no being an isolationist when it comes to infectious diseases. Full stop. Our best protection against Ebola is to help contain it at its origin in Africa. By removing ourselves from the decision-making group at the global table, we gain nothing. We give up our voice, and we don't better protect ourselves. The U.S. withdrawal from the World Health Organization, or WHO, as well as diminished global surveillance and collaborative programs, and the withdrawal of funding to both the WHO and groups like USAID, means that the current Ebola outbreak is likely the first of more outbreaks unless something changes. So in sum, you may not actively be following what's been happening in public health since 2025, or you may be okay with it based on your COVID experience. But the reality is that the real enemy is the pathogens that maim and kill us, and evidence of the danger resulting from our divisions is emerging. Thanks for listening today.